I'm Dr. Daniel Farishta. I'm a facial plastic surgeon at Texas Facial Plastic Surgery. My background and training in facial plastics starts with the foundation in ear, nose, and throat. It's a 5-year surgical residency where it's very detailed and you spend a lot of time learning about the anatomy and the intricate structures in the head and neck. That set the foundation for me to go into facial plastic surgery. Facial plastics is very meticulous craft. You want someone who's willing to spend the time it takes to get the details right. And I found that the marriage of the deep understanding in head and neck anatomy and the aesthetic side of facial plastics worked really well together, and it's something that just fits my personality. What sets me apart from other practitioners is the background in otolaryngology, or ENT. That grueling training in surgical residency allowed me to develop a deep foundation in the understanding of head and neck anatomy, and then blending the aesthetic side of medicine with it to allow for a safe but successful patient outcome. Every patient is different. No one human being is the same, and it takes the time and effort from my behalf to understand you as the patient. I spend the entire consultation just getting to know you, not only what you want, but why you want it. Having an understanding of where you're coming from and why you're here allows me to then best tailor a treatment plan or surgical plan specifically for you. And ultimately, you're the one who drives the conversation and where we end up going. The most rewarding part of my job as a facial plastic surgeon is the reveal from a rhinoplasty. It's my favorite surgery to do, and the look on a patient's face when they see their new nose for the first time is something that drives me and motivates me to continue to do this for the rest of my career. I truly love what I do, and that moment is what brings me so much satisfaction in my career. The technology and equipment used in rhinoplasty can vary from place to place. There are a multitude of techniques that can be done during a rhinoplasty, and no one rhinoplasty is the same as the other. And it's having the best equipment available to provide the best outcome that I like to focus on. So I use a 4K endoscopic tower to allow for maximum and the best visualization on the inside of the nose during surgery. And during surgery, when I'm focusing on the cosmetic or the outside portion of surgery, I wear my surgical loops, and we have the nicest rasps and hammers and chisels that are needed in order to structurally change and shape the nose. The goal of surgery should be to provide you with a natural outcome that helps you look refreshed. I don't want people to see you after surgery and be like, "What did you have done?" or "Who did your surgery?" I feel like that idea of having a super pulled back face or a very, very sharp nose that's super turned up just does not look good anymore. And I want to provide you with a result that'll last you for the rest of your lifetime. You should only have one surgery with me. I don't want you to ever have to have a revision or fix anything that could have gone wrong. I spent the time and the effort to do things right the first time, so you don't ever have to worry about it again in the future. The best way to find me is right here in my Bellaire office. You can call the office phone number at 713-791-1515, where you will find Elaine answering the phone, and she'll greet you and guide you through the whole process. If you find me on social media, on TikTok or Instagram at dr.danielfarishta, you can DM me directly, and I'm happy to help you out in any way possible.